Afternoon. It's a great pleasure that on World Brain Day that we are speaking with my colleagues, Rashmida, and means the CG is over here, but the most important person I would be seeing over here is Shantanuda. I'm really happy to see you and Olunda, one of the veteran, and I was really amazed the way he's made a recovery from his that he was. I don't want to mention that he's gone back to again acting. That is the main thing. What we love to see. So same with Shiva Prasad. He was injured, but he's back to acting and everything. So these are the things which, on the World Day, I don't want to take a lot of time of yours. That's the main thing. What I would say, exercise is the mainstay of treatment. Control your blood pressure, control your sugar, that's the mainstay of treatment, what I would say. And if we can do the exercise and everything, we would be leading a lot better life compared to other people. And that's my advice to all of you. Thank you very much.
Thank you, Dr. Kaushik. So next would have been Dr. Kaushik Sen, our senior neurologist, but he's just gone down for looking after a very acute stroke case. So I request my colleague Dr. Anish Kumar Ghosh to please come and say a few words on the topic. Anish, please.
Thank you, sir. And Medica welcomes you all. A very good afternoon to all of you. As a neurologist, stroke comes first and foremost in our mind. Already, doctors have told about the prevention of stroke, like prevention of some modifiable risk factors like obesity, hypertension, blood sugar, quitting of cigarette smoking. And there are also some non-modifiable risk factors like genetic disease, genetic sources which cannot be prevented. And another aspect I wish to highlight is that to promote awareness, we also commemorate these days like World Brain Day, World Stroke Day, and the like to increase awareness among the population. A study done in India a few years back found that in spite of mainstream media, social media, there still exists around 30% of the population, both in urban and rural areas, who could not recognize the stroke symptoms. And there were 10% who even did not know that stroke was a disease which occurred in the brain. So this is a day which we utilize to promote awareness, like whenever you have an acute facial deviation, slurring of speech, or one arm falling down continuously, or a loss of balance, acute loss of balance, so rush into a nearby hospital, as there are some acute injections available like thrombolytic therapy, which used judiciously within 3 hours, and to in some patients up to 4.5 hours can lyse that clot, and can decrease the disability of that stroke after 3 months. Because a stroke not only creates a lot of disability, it creates a lot of socio-economic burden on the patient and his family. And there are other diseases which can also be prevented, like headaches, common headaches like migraine, with good lifestyle modification, not watching mobiles all the day, decreasing screen time, reduction of your colas and all the junk food you eat, reduction of the caffeinated food and drinks, all helps to reduce migraine. So with these two issues, I welcome you all to enjoy the program. Thank you very much.
Thank you, Dr. Ghosh. Is Dr. Nirmal Roy here? Can I call you, please? So Dr. Nirmal Roy is our interventional neuroradiologist, and he got special training on treating aneurysms and AVMs, and is a very important member of our family. Dr. Nirmal Roy.
A very good afternoon to all of you. Happy Brain Day, World Brain Day from our side, from the team, my team side. I have joined this team for the last 5 months, and I am a neurointerventional radiologist. As you all know, that it appears that all brain surgeries require cutting the skull, but we do it by a very small pinhole through either in the groin or the wrist. We can reach the brain and treat a lot of complex neurovascular cases, and particularly in the setting of acute ischemic stroke that Dr. Anish was telling. So, besides the thrombolytic therapy, now a new treatment has come up that is called mechanical thrombectomy. In that, we can remove the clot in the brain through a pinhole in the groin or in the wrist. So the clot is sucked out of the brain, and a lot of patients make an excellent recovery after doing this procedure. But just remember, for any brain emergencies, it is the time that is the most important thing. And you have to reach to the nearest stroke ready center as early as possible, like we have, where we have a 24/7 cath lab facility, 24/7 CT or MRI scan facility, which is of utmost importance. And we need to do these patients as early as possible. So, as Dr. Anish has already said, identify the signs and symptoms of the stroke as early as possible. And remember, unless these treatment are, these diseases are treated as early as possible, that causes a definite socioeconomic burden to the patient. As you all know, that heart attack can kill a patient, but brain stroke that can not only kill a patient, it kills a family, because the patient becomes dependent on other family members because of the paralysis that happens with the stroke. So we should all reach, these symptoms should be identified at the earliest, and we should reach the nearby stroke ready center like Medica, where we can treat this patient at the earliest. Thank you all.
Thank you, Nirmal. I think you rightly mentioned about